Right.
I come from the patient perspective as also in addition to the hygiene side of it. And it's nice to see the transition because there's been a lot of us that suffered for so long. And I'm hoping that kids don't have to deal with that.
Yeah. Were you able to look back, pinpoint any breathing or sleep issues that you had?
Oh, yes.
Uh,
Oh. I mean, coupled with being a tongue thruster. I think I have a slight tongue tie. It's not super severe, but just a slight tongue tie. And so after my jaw surgery, so I had ortho and headgear and all those things. I was a bedwetter, somebody that's been clenching and grinding since my mom can even remember back. Tons of parasomnias, a sleepwalker, a sleep talker, I mean, just like
wow.
anytime you like see those things, I'm just like checking them off.
Right. That's our entire questionnaire right there.
Exactly. And so it's learning as an adult and now seeing patients, I'm like, please, it has sucked. It has sucked. I'm here, like I'm thriving. It's fine. Like you can get past it, but it has sucked dealing with all these things. So don't, let's catch it early in yourselves and in your children. So it's been a journey for sure.
Good. When you edit the tape, will you send me that little clip, that last little piece there?
Oh, I can, yeah.
That's what we try to tell patients all the time is that you really can treat these things early.
Mm-hmm.
And we say early, it's 3 and 4 years of age now, where we can catch this before it becomes something worse.
Yeah.
And we do see it in adults all the time, how they've suffered.
Yeah. I think from the myofunctional side, my whole ortho journey was because I had a tongue thrust that nobody identified and nobody kind of put me into that, like, let's stop mouth breathing, let's get the tongue up, let's do all that stuff. Right. And then so now I've had from 8 to 16, I had ortho. From headgear to expanders to that horrible, what is that giant mouthpiece where you clenched your teeth into it every
the positioner?
Yes, I have had all of those things and then went back into it at 23 where I got my orthodontic mandibular advancement.
All right. Well, that probably helped to some degree.
Some degree. Honestly, though, I think if my tongue had gotten up in the right position and I had stopped some parasomnias, like my clenching and grinding, I think I could have been A-okay with a lot of those things.
Right.
So I appreciate when I hear people who are out there trying to really change a very antiquated system and get to the root cause of so many issues so that we can thrive as adults.